Hi everyone, it's Margaret Wallace Duffy from Wallace for Wellness, and I'm actually coming to you here from the clinic today. I felt compelled to do this video as I've got something to share that I think is really important. And this time it's about the impact that a situation is having on clinic owners and healthcare professionals like myself. Now, a lot of you know that I'm very passionate about patient advocacy and access to care and doing everything we can to ensure that patients get the best integrative care they can, because that's what they deserve. But today I'm actually coming to talk about and advocate for healthcare professionals like myself. And quite frankly, this video is also to advocate to our colleges to take a look at best business practices and perhaps to really consider changing it. And here's why. This week will be the third case that this clinic is having to deal with patient fraud. Now, about 4 years ago, we faced this problem, and it was a pretty significant case to the tune of just under $10,000. Here's what happened. I am all for making care accessible. I'm all for making it easy for people to submit claims, which means they can now do it often online. Insurance companies have online portals that patients can send in their receipts, but of course they have to be able to supply receipts if they are audited. Here's the problem, and I've spoken to our College of Massage Therapists about this, and I'm going to be candid about it here today, because now this is the third time that clinic like ours, that's been in operation for 28 years with a pristine reputation of honesty and integrity and good care, is having to spend countless hours defending ourselves when it's a patient that has committed fraud. And here's why. As a registered massage therapist, we are told by our college that we must put our registration number on the receipt. That's all fine and good. However, I've always said, why do we have to put our whole registration number? Why are we making that accessible to everyone? There's no doubt that there has to be an ability for the insurance company to cross-reference it with our college to make sure that the person that's submitting the receipt is being seen by a registered healthcare professional. I have no problem with that. But when we are handing our registration number over to anyone and entrusting that they're going to not abuse that is really concerning. And now, when I'm yet again have another case of patient fraud where someone has got our number and then is fraudulently put through countless claims, not just in their name, but their kids' names, their husband's name, because they now have a registration number. That is not okay. Not only is it not okay for professionals like me that now have to spend the time and the energy and the money to make sure that we can assist the insurance company to ensure that they catch this person and bring them to justice, because there's various forms in which that is done, but also because it impacts all of us. That's how insurance rates can go up, because they're looking at what extended health coverage is costing companies, and they're worried about the impact that's having, but are they really true numbers? I'm all about preventative health and keeping people healthy, and at a time like this, we know that preventative health is so important, but are these numbers real? Or how much of this fraud is going on? Well, I know in our clinic, from what we know, we've already had 3 cases of that, and there's a simple solution: not making our full registration number accessible to patients. Maybe part of it's crossed out, and then the insurance company has to cross-reference it with our college. I'm not comfortable with this, and I've had enough, which is why I'm coming live to you to explain my concern and a shout out and asking for something to change, because I know we're not the only clinic that's experiencing this. Now, I know there's a lot of clinic fraud, and that needs to stop too. The reality is that we all have to work together to ensure that we can mitigate this kind of bad behavior and stop the impact it's having on all of our businesses and all of our healthcare premiums or insurance premiums that we're paying as a result of some of this fraud. So, if you're with the College of Massage Therapists, and for all you registered massage therapists out there, be aware that this is happening. When that insurance company calls you to do a spot audit, make sure you do your due diligence to check and to communicate with them from the outset. We certainly do, but it's certainly not protecting us from having this kind of fraud continue to happen in our clinic. And that is very frustrating. Now, on a more positive note, we're going to have a great day here in the clinic helping people to become the CEO of their health, helping them to reduce pain and give them the tools for them to actually live healthy. That's what we want to spend our time doing, not spending our time fighting to prove that in fact a patient has been fraudulent and used our designation that we worked hard for so that they can make some money that they didn't earn. Have a great day, everyone. We'll talk to you soon. Bye for now.